Thank you, Mr. Speaker. Cowardly, a heathen, selfish. Those are the words some use to describe Robin Williams' suicide. These underscore the need that there was a great deal of ignorance and misunderstanding about suicide. Myths surrounding suicide are pervasive and persistent. Given that September is National Suicide Prevention Month, we have an opportunity to dispel these common misconceptions, such as suicide is not that common. This year, 9.3 million adults will have serious thoughts of suicide. 2.7 million will make suicide plans, 1.3 million will attempt suicide, and nearly 40,000 will die by suicide. One suicide occurs every 16 minutes, and one veteran commits suicide every hour. More will die by suicide this year than in car accidents. Here's another misconception. Those who die by suicide should just have sucked it up. But the vast majority of individuals who die by suicide have a diagnosable mental illness. Mental illness is a contributing factor in 90% of suicides, and the risk of suicide increases more than 50% in individuals experiencing depression. Or consider this mistaken belief. Suicide is well planned and a thoughtful act. 25% of people who attempt suicide do so within 5 minutes of their initial decision, and 75% do so within the first hour. Although there is a lot we know about suicide, these myths continue to perpetuate because we don't understand enough why certain populations are at higher risk and what is happening in the brain at the time of suicide. A recent report from the Center for Disease Control and Prevention found that the last decade, here is what happened with suicide rates. The rate for those 35 to 64 years of age increased 28%. For women, it increased 31%. For white Americans, it increased 40%. For American Indian and Alaska Natives, it increased 65%. And the use of suffocation or hanging increased 81%. And despite a continued focus on youth suicide, it remains either the second or third leading cause of death for those between ages of 10 and 25. Rates have also increased dramatically among elderly white men. The report goes on to note that additional research is needed to understand the cause of the increase and why the extent of the increase varies. Suicide is a public health crisis demanding a policy response that to date has been tepid at best. The impulsive nature and correlation with mental illness requires us to treat suicide as a mental health crisis. To this end, I have introduced the Helping Families in Mental Health Crisis Act, H.R. 3717, which authorizes research at the National Institute of Mental Health to enhance our understanding of suicide and advance evidence-based approaches to prevention that are not solely centered around raising awareness. Families of those with serious mental illness already are aware that there is a problem. Unfortunately, a small percentage of those with serious mental illness are not aware they have a problem, but everybody is also painfully aware they cannot get help when someone is in mental health crisis. We can save lives and help families in mental health crisis, but only if we as a nation have the courage to confront mental illness head-on rather than just use phony feel-good measures. My legislation also reauthorizes the Garrett Lee Smith Memorial Act, which is the largest youth suicide prevention and early intervention program in the country. However, this program does not address the full scope of suicide, which can affect individuals of any age. Thus, the House Energy and Commerce Subcommittees on Oversight and Investigation, which I chair, will continue its investigation in our nation's broken mental health system by looking at proven strategies to reduce the staggering number of suicides. It begins with fixing our broken mental health system and providing hope and evidence-based treatment to individuals with families in crisis. I call upon members to co-sponsor that bill. Mr. Speaker, we need to tell Americans that if someone you know needs help, they should call 1-800-273-8255 for the National Suicide Prevention Lifeline. You can also find more online at www.afsp.org, the website of the American Foundation for Suicide Prevention. It is clear that this is a national crisis. If we saw any other disease in this country that had numbers as high as these, 1 million attempts and 40,000 deaths for any disease, we would call upon Americans and the National Institutes of Health and others to take action. Certainly we would call upon Congress to take action. This is demanding our action, for every day more and more take their lives from this serious public health problem. Let us address this. Let us no longer ignore it. So many more lives are at stake. I yield back.